Hi, everybody. Thank you so very much for coming tonight. It is actually a great celebration for us tonight because it was 8 years ago in August 2015 when we had our very first Let's Talk About Race program. It was done at the library. This is all pre-COVID. And we had a great crowd, and we had Gilda Rogers with us. In fact, she presented our first 3 programs, and we have run the gamut of programming on this subject, but we have never ever run out of subject matter. And we could never do this without all of you participating. So not only do we thank our presenters tonight, but a special round of applause to everybody that's been so loyal to this program. We really can't thank you enough. So hopefully we have many years in the future. One thing that we have certainly learned from this program is that race is something that was basically made up. It is not inherent in anybody's DNA to not like someone because of the color of their skin or their culture. And we have discussed this at no length, and we are still discussing this, unfortunately.
16.
Again, if I could just give a reminder, if everybody could mute themselves at this point in time, we really want questions. So hopefully later you will unmute yourself, but for the time being, if you mute yourself, that makes it easier. At some point, we do hope to come back to the library and meet in person and have a hybrid version where people could join us, because we've had people from all over the country joining us for this program. A couple notes about the library. The library is open. During COVID, they had closed all evenings. We are now open on Wednesday evenings. And this fall, we hope to be opening other evenings as well. We're also open on Saturdays. We have all kinds of programs. And again, there are good things about what happened during the pandemic, because we learned that if you can't come to Red Bank and join us at the library, you can join us for many of our programs are virtual. So we're back to some in-house programming, but we also have a lot of virtual programs. So we have a really jam-packed program tonight. I'm not going to take any more time to talk. I'm going to introduce the head of our Let's Talk About Race committee, the great Patty White, who herself has worked in the healthcare industry and has a few words to say. Patty? You're muted.
Thank you. We'll try that again. So, yeah, that's, I'd just like to remind everyone of our Zoom etiquette. Now that we're 2.5 years into using this technology, most of us know how to mute our devices, and please remember to do so. If you accidentally unmute and we have to mute you, we can unmute you, but hopefully we won't have to do that. Also, you'll see that if you like, I mean, for the main presentation, we are going to have a couple of people speaking, and you can set, if you know how, you can set on your screen the speaker view if you like, and we do love to see your faces as well. If you want to keep your video off for now, that's fine. But later on, we will have time for comments, questions, and we would love to see you all. As Linda mentioned, I am a retired healthcare professional. I worked for 20 years as a staff nurse and about 20 more years as a certified nurse midwife. I have a long-standing interest in helping resolve the racial disparities in healthcare, especially as regards to maternal infant health. And we will have some wonderful conversations about this, and hopefully not only the statistics, but how we can resolve it. Claire Phelps is the moderator. Claire works at the library on staff. I'm just a volunteer. And Claire, here you are.
Okay, thank you so much, Patty. Welcome, everyone. Thank you for joining us this evening. I would like to begin with introducing our presenters. Our first presenter for tonight is Dr. Carol Penn. Okay, and Dr. Carol is CEO and founder of Penn Global Visions, LLC. She is lead consultant in All-in-One Consulting Group, medical correspondent for WURD in Philadelphia, and clinical faculty at Rowan University School of Osteopathic Medicine, among other accomplishments. Happy to have her with us tonight, and she is known for her holistic patient care and a sought-after physician, speaker, and author in mind-body medicine. Welcome, Carol. Welcome, Dr. Carol.
Thank you so much, Claire. It's always a delight for me to be here. So of the things that you shared in terms of accomplishments, I think what's most relevant this evening is that, of course, I got my first library card at the Red Bank Public Library and grew up reading there and studying there. I studied for my medical exams and my medical boards there, looking out at the beautiful Navesink River here in the land of the Lenai Lenape, the indigenous people who cared for this land and tended this land and made it possible for us to gather here this evening. And I'm a fourth generation Red Banker, so I am a homegrown girl. And it has been one of the great delights of my life to return home to my home community and to be a part of the wonderful things that the library is doing and the wonderful things that this community is doing. And one of the wonderful things is to be able to be a volunteer, one of the volunteer physicians with the Parker Clinic. And I know you're going to be learning a lot more about the clinic tonight. And a big shout out to my friend Linda and her husband there in Florida. And I'm so glad to see that you and Weldon have joined us here at this evening. So a little bit about growing up in Red Bank and what medicine was like in Red Bank. And in some ways, we're living downstream of that and what it is still like. So many of you know that I am the daughter of Alma Penn, who was the director of nursing at Marlborough State Psychiatric Hospital, first African-American woman in the state of New Jersey to become a director of nursing, and the second one in the United States. She was a graduate of Howard University's Friedman's School of Nursing. And for those of you that don't know about the Friedman's Bureau, I invite you to look that up and to understand what that history was. At the time, just to give you a little snippet, the idea was that, and this was something that President Abraham Lincoln signed into existence, that the African-American people and indigenous people would be educated and trained in the art and science of medicine to take care of our own people. And it served right up through 1970 when a lot of the Friedman's schools and hospitals closed. Howard University's Friedman's Hospital was one of the first to open and also one of the last to exist in its original intent. So my mom was a part of that legacy and part of that history. That's where she went to obtain her nursing degree. And her letter of recommendation was written by Dr. James Parker Sr. So many of the African Americans that lived in Red Bank were taken care of by the Parker family. And the Parker family is also part of this Friedman's Bureau and this history of becoming educated, becoming medical professionals through the historic Black universities and colleges. But this one particularly has to do with Howard. But back before that, Dr. James Parker Sr., along with my grandmother, Marion Harvey, who is my mom, Alma's mother, and also Count Basie's family, they all migrated from the state of South Carolina as part of the 6 million African Americans that were escaping the racialized terrorism of the South that came north. And that migration also didn't end until 1970 or thereabouts. And it started in the mid 19 teens. So, after Reconstruction era, when they found out that, all right, slavery was over in law, but the unequal life, the harsh treatment, the murder, the lynchings, the burnings, the beatings, all of that was still continuing. And it was very difficult for a person to have a life or even imagine a future. So my grandmother was a part of that migration. And they arrived, those families whose histories forever became intertwined, in around the Red Bank area, around 1916. Calvary Baptist Church, which is still there on the west side of Red Bank, was a big hub, particularly for people from South Carolina. And of course, there is the AME Zion Church on Shrewsbury, AME Zion, and Pilgrim Baptist, and they were all very important historically. Well, my grandmother met and married a young man who was to die in that first pandemic, the Spanish flu of 1918. And so here she is, a young widow with a son. She meets and marries, whom I know is my grandfather, George Harvey, and they have a daughter, Alma. And their home in Red Bank is on East Sunset Avenue, where they were the neighbors of the Green family, another prominent African-American family in Red Bank. So we're going back, 1916 to 1920. And so Joseph is a little boy. He's growing up on the east side of Red Bank. They're having a life. My mom comes along. She and her brother are 4 years apart. Mom was born in she was born in 1922. She would have been 100 on her last birthday. And they're growing up, and the Parker family, Dr. James Parker, is caring for them, meeting their healthcare needs. This was, make no mistake about it, a very segregated community. There was the Black side of town, and then there was the other side of town. And depending upon when your family was identified as white, that allowed you to literally move across the tracks. Because at one time, Germans weren't considered white, Jewish people weren't considered white, and Italian people weren't considered white, nor were Irish people considered white. But as history moved along, then these different groups became designated, and the designation of white had to do with points of access as much as it had to do with your economic status. But of course, if you lived in a brown or Black body, you were never going to get that designation, even though you might have been moving along in terms of education or moving along in terms of economy. And you certainly weren't going to get that designation and be treated that way in terms of your healthcare needs in the community of Red Bank. So if you imagine this year, 1926, my Uncle Joseph is 9 years old. My mom is 4 years old. Penicillin had not been invented as yet. So many diseases, we had the term, and we still use that term, supportive care. So if you could get to a hospital and be admitted to a hospital, you would get IV fluids and supportive care for a lot of diseases that we now have treatment for. So much like COVID, when COVID first came, what you had to have supportive care because if you didn't know how to treat it. Well, if you got appendicitis in 1926, or your appendix ruptured and you developed peritonitis and sepsis, the treatment was supportive care. So that meant IV fluids. And little Joseph developed an appendicitis. His appendix ruptured, and Dr. Parker did everything that Dr. Parker could do in his home office, caring for this child. And the decision was made because at that time, no Black doctors in these areas had admitting privileges in any of the hospitals. So Riverview, Monmouth Medical, Fitkin at the time, now Jersey Shore. So if you needed that level of care, well, you were pretty much left to, if your constitution could tolerate it. Well, a child becomes dehydrated very, very quickly. And if you know anything about a sepsis or a peritonitis, you've got a lot of profuse vomiting, you've got diarrhea, and you rapidly are losing your body liquids and your electrolytes, which and death is going to come very quickly. So, but Dr. Parker was still determined to save young Joseph, but the only place where he had admitting privileges was at the Wright Sanatorium, which was the only Black hospital in New Jersey at the time. And so they made the decision to wrap this child and take him to the Wright Sanatorium. He was 9, he was a little boy. He didn't survive. And so that story is a story that I carry with me. I'm really doing a lot of research right now, and I'm calling it Finding Joseph, because no one really knows where Joseph was buried. My grandmother was brokenhearted, as you can imagine any mother would be. It's a parent's worst nightmare, the death of their child. And to watch her son's life ebbing as she held him in her arms and held my mother, because my mother didn't want to leave her brother's side. She was, they were 5 minutes away from a hospital, 5 minutes, and maybe he wouldn't have survived, but you would have felt he had a better chance of survival had he been able to get the supportive care. So here in this community, there was a medical apartheid that was practiced. And what is important for people to know is that it's not abstract, and it is not something that happened to somebody else. In this case, it happened to me, it happened to my family. So there's an uncle that I always grew up knowing that there was this little boy, but it's an uncle that I never got to know. It is the brother that my mother loved and didn't get to grow up with. And it is the child that my grandmother lost, and a part of her heart, a part of who she was as a woman, is buried wherever my uncle has been buried. And I think it's important to know that these decisions, these policies, this hatred cost people their lives. And it is not something that is abstract, it's something that's real. And we are still downstream of these policies. We have gotten better, we are growing, we're expanding. My mother, for goodness sakes, ended up going into medicine with the letter of recommendation from Dr. James Parker, whom she knew did everything that he possibly could do to save the life of this little boy. And yet, I think how sad and how tragic for Dr. Parker, a person who's trained to save lives, who did save so many lives, and who contributed so much to this society. I think my uncle's story is one of many stories. The people that couldn't be saved, the people that couldn't be helped, yet they were within arm's reach of that available help. But that help was withheld because of racial hatred, because of systems and beliefs. It's a question. It is a question that we need to ask ourselves in the medical community. Why does this still persist? Why is it that an African-American woman, regardless of her economic status or her educational status, is still 4 or 5 times more likely to die in childbirth, or her child to die in childbirth, than are her non-melanated counterparts? Why are these rates still so high? You know, you name it, in the Latin American community, in the Asian community, and then finally where it's more normalized in a white body community. So, you know, why are these, this hatred, this American form of racism still costing people our lives? And why are we still vulnerable at the hands of the medical community? So it's a question that I ask myself every day as a doctor, and it is a something that I have committed to unpacking and examining, and then asking my colleagues, both those who look like me and those who don't look like me, to stand in that question, to examine our own implicit bias, and then also to be able to have the courage to make the necessary changes. Why? So that lives can be saved, and that other little Josephs in the world don't have to have their lives cut short because of the color of their skin or their ethnicity, or being born in the wrong zip code, or quite literally on the wrong side of the tracks.
Thank you, Carol.
Babe, the fish is done. Rodney?
Thank you so much, Carol. That was wonderful information. Thank you so much. Are we taking questions now, Linda?
No, I think
hope-
it's time
I
to
hope I'm on mute.
introduce Suzy and Dr. Cheslock.
And I
Okay,
hope I'm on mute, but the fish is done. I hope I'm on mute on this conference call. The fish is done.
Dear friends, please
Wait.
remember to mute your device.
You're
The
not
fish
on
is
mute.
done, you're not on mute.
someone needs to be muted. Okay, very good. Thank you. We will move on now. The next person I would like to introduce is Suzy Dyer. She is the Executive Director of the Parker Center since December of 2019. She joins us from Planned Parenthood, where she was Chief Legal Affairs and Compliance Officer. Previously, she was an Assistant U.S. Attorney in New Jersey. And also Dr. Eugene Cheslock, who is founder and past president of the Parker Family Health Center. He practiced oncology for more than 30 years in the Red Bank area. And in July 2000, with community support, business support, they opened the center. He opened the center, and the center is a volunteer-based free clinic for the uninsured in Monmouth County. Today, he is still actively involved in the Parker mission as a board member and member of the expansion and renovation committee for the Parker Center. And we thank you both for joining us. And you actually have the floor at this time.
Thank you, Claire, and good evening. It's really an honor to present to you a thumbnail sketch of how Parker came about. I think you should know as background that Red Bank was known as a medically underserved community for many years. And I think with that background, a number of community leaders approached Riverview late in the last century to provide access to the healthcare system on the west side so that residents did not have to transit across town. The initial response that came back from Riverview was cost prohibitive. We were fortunate to know of the Volunteers in Medicine, the first such outlet in South Carolina, founded by a Dr. Jack McConnell. We brought this up as a possible solution. This was a volunteer-driven clinic in the Hilton Head, staffed by physicians who had retired in the area. Dr. McConnell was a unique individual, and we brought him to Red Bank to meet with Dr. Parker to find out if this was a feasible solution for our area. After a long discussion between those two gentlemen, it was agreed that Red Bank could serve as a free clinic for patients who were uninsured. Quickly, we established the need, canvassing the neighborhood. Dr. Warner, who was then the superintendent of schools, canvassed the area and found out about 40% of the Black population was uninsured. So we knew there was the need. Then we quickly undertook a little leak to the press about our desires to establish a clinic on the west side. And our neighbor, Penrose Realty, that redid the River Street School, was kind enough to donate property. If we could go back, Susie, that's all right. You can see the River Street School in the background, and the building that you see to my right had to be demolished in order for us to set up shop, so to speak. So the deal was, we got the land if we could destroy the building, and a good friend took it down, raised it, recycled, and soon we opened, after about a year of meetings at the lunch break with Mrs. Todd, offering us all her fine services. We opened on July 29th in the year 2000 in a trailer. Maybe we could see the trailer, Suze. This was donated by Paddock Construction, and it was refitted to be ADA compliant by Paddock Construction and Riverview Medical Center. And on July 29th in 2000, we opened to the tune of 2 patients. I give you that history because it was not universally accepted in town that this was a great idea. And one of the council members said, it's good you're opening in a trailer, because if it fails, or when it fails, you can hook up a tractor, it can be towed away, and no one will know the difference. Well, happily, 22 years later, Parker is bigger and better than ever, and we are looking at some very exciting horizons. And I have to tell you, this has probably been the most exciting venture in my lifetime. Coming from my background, working amongst these people who are so industrious, so thankful, and so willing to empower themselves in the care of their lives, if given time and attention. Susie, is there anything else? I think Dr. Parker, whom I absolutely adored, is here tongue-blading me in a joking manner. I love the man. He was unique. If you ever visited his office, he was the true family practitioner who greeted you, took out the chart, made the notes, did the urinalysis, the examination, gave you the prescription, and sent you on your way. Jim had, and his father before him, and I'm sure Dr. Parker, the dentist, better known as Moose, all demanded the same thing of their patients, and that was respect, courtesy, and cooperation for the care that was rendered. A great deal of Dr. Parker's service went unremunerated. And so we're so happy we can continue his legacy and that of his father. Here's a picture of our opening on July 7th, 2003 in the building that was that came about as a result of Mr. and Mrs. Bon Jovi. holding an event at their house on Navesink River Road, raising the entire amount of the money to construct the clinic, with a little left aside to buy another piece of land adjoining what was donated to us by the realtor initially. And here's a picture of our happy family with our unconventional building. The happy family has grown immensely over the course of our history. And Suzy will let you in on how COVID played such a significant role in where we are today.
So good evening, everyone, and thank you so much for inviting us to be a part of this program. Linda, it's truly a pleasure to be amongst this group. COVID-19 posed a lot of challenges, as you've all read. One of the challenges that we immediately faced as soon as COVID hit was that people stopped coming. People were afraid. People stopped getting the healthcare that they needed. And that has come out in our patient numbers, because Parker is a microcosm of what you're reading about in the press. That people stopped going to the doctors. People weren't taking care of themselves. They were afraid. And last year we saw 1,051 unduplicated patients, but we had over 9,000 visits. So what does that mean? What that means is people weren't coming and getting the care that they needed. When they did come to us, they were a lot sicker. Parker was fortunate in that we were able to vaccinate not only our patients, but we were able to vaccinate the entire community. And that was an important obstacle to our providing care in the community. We had to seek federal permission to do that. And why I'm going into a little bit of detail on that is because Parker is a medical home for so many people in the community. And it's a trusted medical home in the community. And using that trust really helped get us through and many community members through COVID. The challenges that we faced with COVID-19 was getting access to vaccines. And it wasn't just the Black and brown community, it was the elderly as well. It was people who didn't have access to the internet or didn't know how to access portals and make appointments to get vaccines, and didn't have the time to get on waiting lists for those vaccines. And so that was really wonderful. We partnered with a group of wonderful women who were making appointments by phone. That's how we did it. There was no Parker portal to sign up for a vaccine. We did it the old-fashioned way. You called Parker and we made you got an appointment for the vaccine. The other issue was trust. So you have access and trust. We were a trusted provider in the community, but we had to get the word out. So we partnered with the faith leaders in the community. And our first partnership was with, and I'm going to go back and share the screen. Our first partnership was with share. Let me just arrows.
You're good.
I can get to, everybody can see that, right?
Yep.
The arrows have gone away. There they are. Our first partners were with the Monmouth County Health Department, who provided us with the vaccine, and with Pilgrim Baptist Church. And Pastor Porter has been a wonderful partner through this whole journey. And if he were on tonight, I'm sure he would be laughing when he hears the word journey. But we also went out into the community. we met people where they were, and we tried to make getting vaccinated a little bit of fun. So we were with the Vax and Backpacks group, and this is a Pilgrim Baptist church. We went out into the community. We were vaccinating outside. We were vaccinating inside. And here's the Pilgrim Baptist volunteers helping us with traffic that was going around the block on Shrewsbury Avenue. So it was fabulous. They helped organize, it kept the flow of traffic going. Again, we were out in the community. Here are more of our volunteers at fairs where we were vaccinating. And here's a wonderful vaccine event that we did with over at St. Anthony's. It was a kids event to get vaccinated. In a matter of a couple of hours, we vaccinated 250 people. It was, and here we are dressed up as superheroes, and that is just a lovely picture. But we tried to meet, the point of all of this is that we tried to make it fun and meet people where they were. And spring into action, it was get healthy and get vaccinated. And here we are giving out sneakers as well as getting a vaccine. So keep moving and get vaxxed. We also went to the Mexican consulate when the Mexican consulate came to town at St. Thomas's, and we were there on site to vaccinate so that people who aren't vaccinated, Mexico has requirements as well, and we're not letting unvaccinated folks in. And so this was a way for people to travel back home, and they were fully vaccinated. And now you saw partners in the beginning, and here are our partners today. They're gonna hopefully fly them, right, Jeannie? You have to click on those. Oh, okay, sorry. I do. Yeah, there we go. Thank goodness you're here. And this all happened in 1 year. And this is what made it work. It takes a community, and it takes trust. And it takes all of us working together, because we can't do it alone. And if COVID taught us anything, it is that the health of one of us impacts the health of all of us. And by coming together, that was the silver lining in COVID. We lost a lot of folks, but coming together, we made a big impact, and we also saved a lot. And I told you, I shared with you that, you know, our patient visits have gone up exponentially because the population is sicker. But the other thing that we have been able to offer is we've expanded our programs. And I'm happy to share that we've also seen a 25% increase in our patient numbers just this year alone in unduplicated patients. And so we are looking at expanding our footprint, which this is the picture of. And that's what we are hopefully going to be doing in the coming year. But I'm happy to answer any questions. Oh, one other thing, because I do want to share some stats. Statewide, the number of Black people who were vaccinated was at 9%. For Parker, it was 19%. Statewide number of Hispanic folks who were vaccinated was 17%. At Parker, it was 72%. The numbers speak for themselves, that coming together and creating that trust and creating that community partnerships and working together makes a huge difference. The mega sites closed because people stopped going to the mega sites because they weren't trusted. They weren't reaching the populations that they needed to reach. And people could have gone right down the street to Brookdale, but A, they had no way of getting there. And Brookdale's wonderful, but it wasn't it wasn't the trusted provider that Parker and Pilgrim and all of these churches and all of these partners can provide. So with that, I'm happy to answer, and Jean's happy to answer any questions, but it's really been a pleasure to be with you. Thank you.
Thank you so much, Susie. I just want to say, I think Carol has left, but I'm really lucky to have had Alma Penn as my friend. And the story about her brother, you know, we sometimes talk about statistics, but it's really the stories. When you know the stories of people's lives, then things really begin to change. And learning that story about Alma's brother really hit me very hard when it was told to me. So I really, really appreciate Carol sharing that with everyone. And as far as the Parker Clinic, I told Susie and Jeannie that it really is a cornerstone of our community. And I meant that. I was at that event at the Pilgrim Baptist Church with the wonderful Pastor Porter, who is another fabulous person in the Red Bank community. And that day was truly incredible. Not only were backpacks given out to like about 500 different students, but also Parker Clinic was really busy giving the COVID vaccines. And it was one active day in the town of Red Bank. So thank you very much for that.
Thank you so much, Dr. Cheslock and Susie. We do have a couple of comments and questions. There was a question from Leslie Kahn. Who supplied the sneakers? Do you recall?
It was a bunch of different people. I mean, some people went out to Monmouth University and got sneakers. Others, there were local sneaker store and in the sports store next to World Market. Next to World Market supplied sneakers. And, Sure-footed, yes. And also, actually our podiatrists, our volunteer podiatrists went out and bought bags and bags of sneakers, $1,000 worth of sneakers. So, which was pretty amazing. Yes. So our volunteers, they came from all different sources.
Okay, thank you. That was amazing. Another comment, what a wonderful achievement. Thank you from Susie Wyman.
Also, I just want to, we have another really special guest with us tonight, Linda Parker Edwards, who is joining us virtually from Florida. Linda is James Parker's daughter. Jay Alvin was the dentist. Am I getting this right, Linda?
Yes.
Who was practicing along with his uncle, Dr. James Parker Sr., and his cousin, Dr. James Parker Jr. And if she could say a few words about the Parker family. I don't mean to put you on the spot, Linda. Actually, I do. But,
well, first, let me say happy birthday, since we're celebrating the 8th birthday.
Thank you.
I want to say to Claire and to Carol and to Dr. Cheslock that I know that without the dedication of you guys, this clinic would not have been at all. And my parents, as Carol will tell you, as Claire will tell you, they believed in getting people together. All you have to do is pick up the phone and call somebody and say, look, we're having a meeting. Let's go to church, tell the people at church, let's do this, and spread the word. And people were just there. If it were not for the joint work of this community working together, these things wouldn't have happened. Yeah. It happened to be our family name, and I'm very proud of that. But it wouldn't have happened without so many dedicated people. And I just want to bring up another fact. Dr. Cheslock, I'm sorry for messing up your name, saved my father's life. He operated on my dad. We knew Carol growing up. Of course, I'm a few years older than she. We knew Yanni, her mom. I knew her grandmother. Claire's been to our house and worked on different things with Mom. I'm just blown away. And I'm so proud of what has been done in our hometown. Not just because it's the name Parker, but just because we did it together.
Thank you so much. Wonderful, wonderful. Yes. Red Bank is a wonderful community that way. It really is.
Yes.
I've known it for a
We have a
long time.
lot. We have a lot of stars from Red Bank too. We have several young people that have written books from Red Bank, and there's the Red Bank Block Party with Eddie Russell. There's so many things going on there. And the Thomas Fortune Center, of course, you know, with Gilda, who is our star. But I just
Definitely.
want to say personally, thank you so much. Thank you so much. Let's work together and do some more good things.
Very good. Thank you so much as well for joining us. Okay, and another question, can the speakers speak to the greater issue of racial disparities in healthcare? Any thoughts on that for Dr. Cheslock and Ms. Dyer?
I've been fortunate not to have experienced instances that were related or that we all know happened. I, as a physician, always open the doors to anyone, regardless of payment or otherwise. It's a sad commentary, though, that some folks are denied access to care because of ethnicity or color. I just wasn't brought up that way. The Jesuits spoiled me. And the good sisters in grammar school spoiled me as well as my grandmother, who was a not spare the rod and spoil a child type person. And I just hope that we continue to make advances through instances like this that expose problems, address problems, and try to resolve problems together. I think, Linda, your comments about Red Bank really resonated with me. I don't think a Parker would be possible in a lot of other communities. It's because of our diversity, but it's because of our shared understanding that we're all in the same boat together. And that came out in COVID because folks from Rumson and Fairhaven and Little Silver and Colts Neck couldn't get the vaccine. They came to Parker and they were right next to a gentleman who might cut their lawn or a lady who might do their laundry. And they found out that we are all the same. And that's what makes Parker great. And I think that's what makes Red Bank great.
And also, if I can just add on to that, what Parker is really, I'm so proud that we're able to do is that we're not only addressing racial disparities in healthcare. 72% of our patient population identifies as Hispanic. We are also addressing the financial disparities in healthcare. Being uninsured is a huge obstacle to get, almost insurmountable, to getting the healthcare that you need, to getting the medicines that you need. And what we're able to do here at Parker is also address the underlying social determinants of health. And yes, I'm seeing Reverend Diane. Yes, there is so much racism, but there's also so much. If you don't have the financial wherewithal to access the care you need, that is an enormous obstacle. And the folks that we are, the population that we see, the patient population that we see, we also try to address their healthcare needs, but also the underlying social determinants that exacerbate their health. And so, like housing insecurity, like job insecurity, transportation. So it's and I wish that Carol was able to stay on, but she would say it's a much more holistic approach to care, to try and provide these people with access that they can't otherwise get.
I'd like to also add, Dr. Parker, having gone through what he went through and his father, what they all went through in the exodus from South Carolina, Dr. Parker was the greatest advocate for the Hispanic community. He brought his experiences, translated them into these folks, and anticipated all of the issues that they would experience and spoke on their behalf. That's what made Dr. Parker, Dr. Parker.
Yes. Well, thank you so much. Thank you so much for that insight.
May I just add that the other thing that made Dr. Parker was him being so ornery. He was determined. If he decided he was going to do something, it was done.
Oh, and I see a comment
Right.
from Phyllis, and Phyllis and I do know each other, and
Okay.
Phyllis, we agree with you that there are so many challenges in maternal health and reproductive health that definitely are traceable to economic as well as racial differences.
I think Reverend Diane.
Well, actually, I was responding to Reverend Diane, with whom I agree totally. For
Yeah.
many years, differences in health outcomes seemed obviously connected to financial and access issues. And in certain specific cases, that was true. Delayed diagnosis, delayed treatment, that was because of economics and access. But in the area of reproductive health, particularly in prenatal health and maternal mortality, once you can clear for all of those economic issues, and still we have enormous disparities that are attributable only to racial differences. And it took a while to recognize that, and God help us, it's taking much longer to respond to it. It took a long time for obstetricians who saw mostly middle and upper class women of all races in their office to really recognize that the well-dressed professional Black woman in the office was still struggling with her health outcomes in a way that the rest of his patients weren't. And he didn't expect to see it in his waiting room. So it took a while for the aha moment to come through. And we have a lot more work to do on the response.
Absolutely.
Reverend Diane has her hand up. She might have stepped away from the screen for a minute, but
No, I'm here.
okay.
I'm here.
Yes.
I'm here.
If you-
I can't see myself, but can you hear me?
Yes,
Yes, we can.
Yes.
Yeah, I was struck by what Dr. Carroll said. Similarly, my family came up through the Great Migration from North Carolina. And my father talked about his first cousin, who at that time, you lived in a house with multi-generations, and his first cousin, the hospital that they were closest to in proximity was the white hospital, but the Black hospital was quite a while away. And it seemed to me what he was talking about, because I used to be a maternal health nurse. I worked in neonatal ICU, and it seemed like what he was describing was placenta previa or an abruptio event that his cousin was having a fetal loss, and that can be a maternal and fetal health crisis. And apparently they took her, they had no choice but to take her to the white hospital, and they had her on the steps of the hospital, and the white nurses and physicians crossed over her as she bled to death. And that kind of thing will scar a person. That will scar you for life. And so then consequently, when my parents moved to New York, my mother, she started the the nursing profession. My mother was the first of the nurses in our family, and she graduated from Harlem Hospital in 1953. And I'm a nurse, and my daughter's a nurse, and my son's a nurse. And my mother at that time, and you think of New York as being this liberal place, but at that time, they certainly had segregated nursing schools, and the white nurses went to Bellevue Hospital and the Black ones to Harlem or Lincoln. And she talked about her clinical experience having to go to Bellevue, her and her classmates, and how badly they were treated by the nurses at Bellevue Hospital. And that was, of course, in the 50s. So, you know, but I myself, being from New York, I had not experienced that because I was not born. I was born in the 50s, but I was, of course, of a different age when civil rights and all of that came about. But what I have seen in my own 40 years of nursing practice in Staten Island and in New Jersey, primarily I worked for Hackensack Meridian, Raritan Bay, and Perth Amboy, a lot of times in the emergency room. And because I do have a degree of proficiency in Spanish, I would see people coming into the hospital, women coming into the hospital with babies with fevers. And it would be as if I was in a foreign country, if I was in Florence, Italy, or where I spoke no language, and somebody saying, tell me what's wrong, and the person unable to communicate. And I've heard nurses tell the patient, if you can't speak English, I cannot help you. And then I would leave my patients and I would say, excuse me for a minute. And I would go to this crying mother and ask her, ¿Cuántos días tiene el fiebre? How many days has your baby had a fever? And the woman would cling to me crying, so glad that somebody could communicate with her about her baby. So I know, and I've seen cases, I've seen when I worked in neonatal ICU, and of course, you have situations whereby, you know, viability is questionable, whether or not a baby's going to make it, what was the baby's weight, what was the baby's birth weight, how many weeks gestation. But I saw for my own eyes, being the only Black nurse there, that anytime it was time to pull the plug, they quickly pulled the plug on the Black infant. Now, I never did any kind of quantitative or qualitative research analysis. All I know is what I have seen over 40 years in my practice as a nurse.
Wow.
And if
Thank
you
you
want
so
to
much
talk
for
about
sharing that.
class, and regarding class, we know we live in a very racist, classist, and sexist world. Right now, Serena Williams is playing, and she, as wealthy as she is, had a very difficult time with her pregnancy. And when she spoke about it, she wasn't listened to.
Yes.
That's all I have.
Somebody
other
did
than to
mention
say
that.
this, other than to say this, I am a clergy person at Pilgrim Baptist Church. So on behalf of Pastor Porter, I will say how much we love Parker Clinic, Lunch Break, Soul Kitchen, the Bon Jovis, the pharmacist on Shrewsbury Avenue, all of the partnerships as we work all together. Patty knows very well. I always tell her I want to join these race matters. I've joined it the times that I can, but very often this time slot is a difficult one for me on Wednesday. Everybody knows Wednesday nights in most churches is Bible study. So, but I'm so happy to be here present with you now.
Thank you.
Thank you so much, Reverend Diane. And
Reverend-
Patty has her hand up.
Claire, if I could just say one thing, because Reverend Diane raised a really good point.
Yes.
I mean, many good points, but one point that we saw over and over again is language. Language was such and continues to be such an obstacle.
Mhm.
And I will give you one example. When we first started vaccinating, and that was Reverend Diane, I believe we were starting to vaccinate in early February. I want to say February 2nd. The consent forms that you had to sign to get your COVID vaccine were not translated into Spanish. The vaccines have been available since December, but the consents hadn't been translated. We had to have our own interpreters translate those into Spanish. They eventually caught up, but I just want to say that is such a huge issue. You call to make an appointment, you can't get through to even make an appointment to get your blood work done, to get a doctor's appointment. That is such a huge barrier.
Yes, yes.
Susie, I'm sorry,
Thank
the
you.
library could have probably helped you with that. And also the resource center might have been able to help with that. I know when I first started at the library, we had a lot of Latinx people that would come in, and we had nobody that worked at the library that spoke Spanish. It took years to change that, you know, and it still is a problem. And Reverend Diane is correct that, I mean, the reason we're still having this program is because things like healthcare disparities still exist. And if we learned anything through COVID, as wonderful as the Parker Clinic was, there certainly were people that died from COVID because they couldn't get the care that they needed. So.
And may I just say one more thing? A lot of times what happens is people mistakenly think that if they just have paperwork translated into Spanish, because we are used to public education in this country, but many of our immigrants cannot read or write Spanish. And of course, as anyone would be even here, if they are not literate, it's a source of shame. So they may not admit that they are not able to really understand what the paperwork says. I came to find this out through various programs that I worked with, maternal high risk reduction programs and maternal fetal drug programs. And we had all this paperwork printed in Spanish, but sometimes the issue is the inability to read it.
Absolutely right. And what we have done, as you know, Reverend Diane, we would sit and explain it.
Absolutely.
Okay. I think Patty has her hand up for a question, Patty.
Yeah, I first I want to thank you, Reverend Diane. I feel like I just went to church. That was great. And I really feel like, you know, this conversation is very emotional because of we're talking about people's lives, and especially when we're talking about maternal infant health. And what I wanted to share, though, because we do, when we look at the statistics and we hear the stories, they're horrible, they're terrifying. The United States maternal mortality and infant mortality outcomes are just horrible compared to the rest of the developed world. We are on a level with some of the much less privileged countries in the world. So part of the answer lies with, many of the answers lie with the good deeds that are being done in our communities and working at the community level. But we also have to prevent these problems by changing the systems. I mentioned that I'm a retired nurse midwife. I came across, I had the opportunity to meet a nationally renowned midwife, Ruth Lubick, who started birthing centers in a couple of places in the country. And she recently moved to Red Bank. When in 2008, a Dr. Ronald David, who was a neonatologist and a pastor, a very well-renowned Black man in his circle, wrote an editorial actually addressing Congress, suggesting that the response to infant mortality in the DC area where he lived was to visit the birthing center that Ruth Lubick established in Washington, DC, which was lowering maternal and infant mortality. You can find that letter online. And then recently, June 23rd, 2 months ago, NJ.com, one of the reporters, Susan Livio, wrote an article about a study that just came out. The report is called I'm sorry. It's put out by the Healthcare. I'm going to put the link in the chat. The Healthcare Quality Institute and the Berg Foundation have concluded in this 47-page study that using midwives to deliver babies will save more lives in New Jersey if we put this, use midwives more. I can go on and on about midwives. I worked in the field. There's massive amount of evidence, and it's just one of the many ways that we can change systems and policies to prevent these problems in the first place. So thank you, everyone.
Mhm. Thank you so much, Patty. Two other comments. Well, Leslie Kahn says maybe we need more people of color in medicine. Valerie Brett also mentioned what happened to Serena Williams, that she almost died in childbirth. So even the financial success doesn't guarantee good health care. Leslie also thanks us for pointing out that many Spanish speakers don't read the language. English language classes do best teaching students first how to read Spanish, then English speaking and reading, writing. It's a big job, but very much needed.
Leslie would know this. I think that Leslie is still at the Newark Public Library. The last I knew, that's where Leslie was working. So
Okay,
yeah,
okay.
she would certainly know this.
And she would know. Is she still with us or?
I think she is.
Okay,
She is
I don't know if she wanted to
But she's retired.
elaborate on anything. Okay.
Oh, Leslie, that's sad for Newark.
She
I
is.
see Lorraine Stone has her hand up.
Lorraine?
Okay, Lorraine.
Am I unmuted?
Yes.
Yes. Okay. Thank you, Red Bank Library, for this wonderful evening. I really appreciate it. And before I go forward, someone is wearing a Hampton t-shirt. I saw it. So that is my alma mater. So I just want to say hello to the Hamptonians.
Mine too. My
Right.
sister Seal and I both graduated from Hampton University, but we, Carol said our parents did Lincoln, and we are all the black colleges.
Yes. I worked at an organization that's gone now, Regional Perinatal Consortium of Mamas. It was a maternal child health organization. So I was an outreach worker, and my outreach was to African American, Afro-Caribbean women, and their families, to talk about healthy mommy, healthy baby, healthy pregnancy. You know, I talked to them about food, what they ate, what they drank. But one thing I came to realize, and you know, I did a lot of research and there were also a lot of classes. Stress is a huge determinant. And I know everybody has stress, but when you're Black in America, the stress is more than sometimes others experience. And that stress impacts your health. You know, statistically, we have more high blood pressure, diabetes, heart disease, on and on. But when you have stress and you're pregnant, whatever the mother is going through, the fetus is going through. And so this is a good gathering. So I don't really have to preach hard to the choir, but we really have to continue to support pregnant women and realize that what they go through every day, pregnancy is a beautiful, wonderful thing, but there is stress involved in pregnancy, and we have to support women, and we have to support their families, because a woman takes care of her children, maybe her mother, maybe her aunt, maybe her husband, somebody. And when I talk to them, they would say, oh no, that's not stress. That's just what I usually do. We don't always understand how much stress we live under. And so as we talk to women who are pregnant, and as we talk to young mothers, we need to listen to them and hear what their lives are and share what we can in helping them to come to terms with when they're living with stress and what are stress reducers that they can bring to their lives. No woman that I worked with had any idea. So the consortium created programs so women could get to know that, hey, this is a way to let go of some of that anxiety. Maybe it can feel a little bit better. So that's it. This is such an important topic. And anytime that there is conversation about health disparities, I think we can all benefit and there's much to share. Thank you.
Thank you so much, Lorraine. Thank you again. And I do have one question to pose out. Just yesterday or Monday, I heard a piece on what's called medical gaslighting. And I don't know if anybody would like to speak to that, but you know, it seems to occur a lot more with women and people of color, where, you know, women are just not believed, and their symptoms and all kinds of issues are just passed over and diminished by some of the medical field.
I heard the same presentation, and sadly, it is true.
Mm-hmm.
My wife reminds me about my selective hearing all the time. But I don't mean to make light of what is a truism.
Mm-hmm.
It's sad. I think we're making headway, but it can't be fast enough. And I think education and repeated presentations and drumming it into the heads of us males may make us more responsive in time. I will tell you this, when a woman came with her husband to visit me in the office, she was the better advocate than the man.
Mm.
It's sad that they can't advocate for themselves more with the medical community, or the medical community doesn't listen.
Right, right. Well, thank you. Thank you so much.
All I say, ladies, is keep it up. Everything that I've been involved in life has been pioneered by, or if you will, led by women. And I will.
So don't you think the Equal Rights Amendment should be ratified? I mean, that's another issue for this program. We need to ratify the Equal Rights Amendment.
One of my hot buttons. Thank you.
Yeah.
Mm-hmm.
Lorraine, just to go, I would just like to comment on your point about stress, because it is such an exacerbating factor in overall health for pregnant women, and I'm not minimizing that at all. Absolutely agree with you. But I will also share that as a result of the pandemic, the mental health is now an epidemic. There aren't enough counselors. We received a call here at Parker with school nurses begging us, and there wasn't a dry eye on this side of the table, begging us to lower the age that we saw patients from 5 to 3, because they had so many 3- and 4-year-olds that were suffering from stress that they couldn't handle, and as a result, mental health issues that they could not handle, and they wanted Parker to be their medical home. And we are very fortunate that we have a bilingual therapist who see these children. So I totally agree with you, Lorraine, that is a enormous problem, and it's throughout the country.
Thank you so much. Thank you so much. Lorraine, did you have another question?
No, I think her hand is still up. So,
Okay,
Valerie Brett
Sorry, I
put
can't
in
get
the
my
chat.
hand up.
yes, Valerie Brett commented in the chat that the VNA has a program to train doulas who come from the local communities, including Black communities, that many people and groups help to fund, including Impact 100 as a funder. Perhaps as a follow-up, we can get in touch with them and hear how the program is going.
Hi, Claire, it's Valerie.
Hi.
I kind of listed that out there. I came on tonight because I was so interested in the topic of the racial disparities. And as a member of Impact 100, one of the grants that we gave out this year was specifically for the VNA to train doulas in Black communities because they realized that how successful doula programs are. And I believe, though I'm not 100% sure, that New Jersey recently allowed doula payments to be accepted as part of Medicaid. So there's this whole, multifaceted approach to trying to close the gap of maternal health. And this program, as far as I understood it, now I was just, learning about it as an Impact 100 member, so a very small little snippet, but it was two-pronged in the sense of it allowed the program both created jobs for women within a local community who might be interested in a healthcare type of career or entrepreneurial career, giving them training and allowing them to become doulas. And because the women were already part of an existing community that was burdened by these, unequal outcomes of maternal health, they would automatically be helping existing community members to try to change that dynamic. So from my perspective, it was a win-win in terms of programming to change that racial disparity within maternal outcomes. I'll be honest, I don't know where the program is or how successful it is, but as I listened to the conversation tonight, one thing that strikes me is, geez, there's all this great stuff going on right now with what VNA is trying to do in terms of a model within this, maternal health disparity, and this conversation that we're having, engage community members who are also interested in this topic. So maybe it makes sense to try to get them together.
Excuse me, Valerie, could you please explain a little what a doula is and does for those who don't know?
Yeah, again, I'm not a medical person, but so I will just explain in terms of layman's terms. It's I think it's generally women, but I wouldn't say it's always women who help in prenatal care for a woman who is prenatal during the birth and then postnatal care. So they're not a physician, or they're not a physician's assistant, and they're not qualified from the traditional medical system. However, they are definitely qualified and trained to assist anyone who is, pregnant and about to become a mother, go through and help them through the steps of when you're pregnant, and then when you're having a child. Often the doulas are in the delivery room. And then they help afterwards as well with everything that the mother will be doing in terms of being a mom. That was a very non-medical explanation of what a doula is. Traditionally, I will say doulas are, thought of in our culture as, oh, that's what wealthy white women do. They hire somebody to help them out with something like this. And it has been closed off to people because it's not usually covered by insurance in any way. So I think if you look at doulas, both nationwide and across the globe, they really help maternal outcomes and child birth and success. And so it's just kind of now this program, as far as I understand it, and again, I'm not involved in the program in any way, I'm just aware of it, that it's able to now take this service that is viewed as an ancillary service for rich white women and bring it into communities of color here in Monmouth County. And it's a part of a larger effort within the US. Is anybody else on the call familiar with this?
Very good. Thank you so
No,
much.
I have heard of it. Thank you, Valerie. I have heard of it. You know, my understanding, my experience with doulas is largely in as labor support personnel. You know, they're there to walk with the woman, you know, rub the back, get the fluids, just, you know, be there through the whole labor, as
More
well as
than that.
before and after. Thank you.
More than that.
Yes, Lorraine.
Yes. Okay. Hi, I'm unmuted again. I am a doula. And Valerie did give very good points, but you know, doulas, in my experience, I was trained as a community doula at a time when there were no hospitals in New Jersey that would allow doulas to actively participate. And you couldn't get paid. Hence the idea that doulas were just for rich white women. So when you have a community doula and the woman goes to a clinic or goes to a doctor, and the doula can be paid through Medicaid, perhaps, then the doula is available to the woman. And it could be from 3 months on through. But the doula helps the woman to understand pregnancy, her body, that it's not a curse, that it's not a mystery, that the baby is really in control to a great extent, and that, you know, we work with our bodies to bring the baby forward. Doulas also help with discomfort, as I like to say in pregnancy. I try not to use the word pain, but you know, there's massage, there's aromatherapy, there are many things. And doulas, I have been asked to leave a birth simply because a doctor said, well, there can only be 2 people in the room. And I wasn't going to say to the father or the grandmother, you can't be here. So sometimes doulas still have a hard time getting into the quote medical world. It's still a process, but it's really, really important. And women do better often when they have doula assisted births. Okay, I'm done.
Okay, thank you again, Lorraine. One more comment from Leslie Kahn. Also needed are death doulas. Hackensack Meridian Hospitals had volunteer programs that were suspended when the pandemic began. Okay, that's interesting as well.
I think we're almost at 8:30, Claire. Does anybody else have any questions before we wrap up? Anyone? Thank you so much to everyone for being with us tonight. And Linda, thank you very much for being from a family that has contributed so greatly to the Red Bank community. We honor you and your family. And Suzy and Dr. Cheslock, great, great program. Carol's gone, but thank you so much, Carol, for sharing. And as always, thanks to all of you for making this possible. Our next program is the last Wednesday. What's the date, Patty? Do you know?
September 28th.
We're not sure what the program is, but we know that we'll be having one. So please tune in again, the last Wednesday. I'm sorry that Wednesdays are a tough night, Reverend Diane. Maybe in the future we can change it to a different night, but it's worked so far for 7 years. So anyway, we thank all of you so very much for coming.
Thank you.
Good night.
Thank you so much to all our presenters. Have a wonderful night.
Yeah, thank you. Thank you. Good night.
Thank
Good
you,
night.
Good
everyone.
night.
Thank you.
Good night.
Good night.
That was pretty animated.